Hi and Assalamualaikum, especially to my lecturer, Madam Surai Hamimi binti Masto. My name is Muhammad Fitri bin Muhammad Kaifis from class BA 2433D. The purpose I made this video is to describe the issues and the suggested solution about job loss related to the human resource development. Based on the article that I have been studied, almost half of adults in families losing work during the pandemic avoided healthcare because of cost or COVID-19 concern. The COVID-19 pandemic and resulting economic downturn are posing new challenges for families seeking healthcare. Not only have many providers rescheduled patients' visits for close their practice because of the pandemic, among adults in families losing work or work-related income because of the outbreak, more than half of those with lower incomes and those with uninsured family members, those in families with chronic conditions and parents living with children under 19 were in families that avoided healthcare because of cost or concerns about exposure to the coronavirus. So, the first issue of families losing work and avoiding healthcare due to cost and COVID-19 risk is that it can lead to serious health issues down the line. When families are forced to choose between paying for healthcare and putting food on the table, they may choose to avoid healthcare altogether, which can have negative consequences for their health. Additionally, the COVID-19 pandemic has made the situation worse as many families are afraid to seek medical attention due to the risk of contracting the virus. This can lead to untreated illness or injuries, which can become more serious over time. So, one suggested solution of these issues is to implement telemedicine programs. Telemedicine refers to use of technology to provide healthcare services remotely. With telemedicine, families can receive medical attention without having to leave their homes, which reduces the risk of exposure to COVID-19. Additionally, telemedicine can be more affordable than traditional healthcare, which can help families who are struggling financially. Telemedicine can be used for a wide range of healthcare services, including consultations with doctors, mental health services, and even physical therapy. By implementing telemedicine programs, we can help ensure that families have access to the healthcare they need, regardless of their financial situation or the risk of COVID-19. Other issues related to the families losing work avoided healthcare because of cost and the COVID-19 risk is affordability challenges. Many non-elderly adults and their families are also foregoing potentially critical healthcare over fears of being infected with the novel coronavirus. Nearly 1 in 3 adults report that someone in their family did not get healthcare because of concerns about exposure. Among adults in families losing work or work-related income, these concerns were more prevalent among people in families with chronic conditions, parents living with children under 19, and adults with low incomes. Avoiding or delaying needed healthcare, especially for people with ongoing medical needs or who have experienced the outbreak's negative economic consequences, could adversely affect individuals' long-term health and widen racial or ethnic and socio-economic health disparities and existed before the pandemic. Top medical visits among all the patients appear to be rebounding to pre-pandemic volumes. Visits for specialties such as behavioral health and pediatrics remain well below the baseline. For children, missing needed medical visits to ensure healthy growth and development risk negative long-run effects on their health and well-being. Emerging evidence shows reductions in vaccinations order for and administered to children and declines in well-child visits, placing children and others in the community at risk for otherwise preventable diseases. So, the solution is ensuring fewer people lose health insurance coverage and the ability to afford care when they lose their jobs. Reducing the extent to which people forgo needed healthcare will also require lowering transmission risks during healthcare encounters. Thus, the CARES Act addressed shortage in the personal protective equipment by including provisions to purchase and distribute these essential supplies. Shortfalls are still being reported and will likely worsen with the recent upticks in COVID-19 cases. These concerns include expanded workplace safety protection specific to coronavirus, including for healthcare facilities, and an increase in the production and supply of emergency medical supplies, including personal protective equipment. In conclusion, families losing work and avoiding healthcare due to cost and COVID-19 risk is a serious issue that requires immediate attention. By implementing policies that provide affordable healthcare, offering financial support to families who have lost their job, and raising awareness about the importance of healthcare, we can help elevate some of the financial burden of families and ensure that everyone has access to the medical care they need. So that's all from me. Thank you.